Hello, I'm Mark Pegram. I'm a medical oncologist at the Stanford University School of Medicine and the Stanford Cancer Institute. I'm the Associate Director for Clinical Research there and a member of the Breast Oncology Program. There's a lot of controversy about staging of breast cancer. So let's focus on exactly what is breast cancer staging and what do doctors mean when they're talking about staging. Staging is a simple concept. It simply means a description of what the size of the tumor is at the time of diagnosis, how much it's grown prior to the time of diagnosis, and how far breast cancer may have spread at that time of initial diagnosis. Historically, the staging system has depended on the tumor size, the presence or absence of spread to the lymph nodes, typically those under the arm, or spread to distant organs like to the bones or to the lungs, the liver, etc. For example, tumors that are ductal carcinoma in situ without any true invasive breast cancer are called stage 0. And historically, tumors that were less than a couple of centimeters with negative lymph nodes were called stage 1. And larger tumors that were 2 to 5 centimeters with positive lymph nodes, either with or without positive lymph nodes, I should say, were stage 2. And big tumors that were larger than about 5 centimeters and with or without extensive axillary under the arm lymph node spread, bulky spread to the lymph nodes, those were locally advanced or stage 3 patients. And then distant metastatic disease was called stage 4. And this was the situation up until about 2018, when these anatomical considerations of stage based on tumor size, lymph node status, and spread to distant organs, when they were the only criteria, in 2018, there have been new factors that have been added to also add further nuance to the staging criteria for human breast cancer. And these include tumor grade, which is basically a measure of how organized the breast cancer cells look. Are they trying to form breast ducts in the tissue like normal breast cells would? Do they look normal, or do they look primordial, very irregular, which would be high grade, for example? Estrogen and progesterone receptor status is another marker that's been added into the staging criteria, as well as the HER2 status. As you know, HER2 positive patients may benefit from a number of different HER2 targeting drugs that have been highly effective. And so now that's added to the staging system. So the system has recently become more complicated since it's not just anatomical. Consequently, I recommend that you go to the Susan G. Komen website, which has a very detailed and complete catalog of the current modern staging systems since 2018 with all these other parameters integrated. And the website for that is www.komen.org/breast-cancer/diagnosis/stages-staging. Let me read that one more time, www.komen.org/breast-cancer/diagnosis/stages-staging. And that has a beautiful chart that has all of the nuanced categories for staging of breast cancer. And then you can be right up to speed along with your doctors and medical staff in describing the stage of breast cancer.